We're talking about is it
Cranzalizumab.
Why was it stopped? Because a lot of patients said it helped them a lot. Like, that treatment really helped so many people
very quickly.
Yeah, and so many people said it was because the money was too much and they can't be bothered to use it on sickle cell patients.
Yeah, some people actually complained that after they stopped it, their sickle cell got even worse.
They were like, why introduce something they can't
and then take
keep
it out
up
so
with,
quickly.
Okay, I want to talk more about cranzalizumab. When it first came out, I have a concern. And to be honest, I'm outside there and I think my manager, he can testify for it. Because firstly, anytime medication I'm talking about, because I'm a prescriber and I see medication, I like to read fully about the medication, side effects and everything. When I saw the side effects, it gave me concern.
Oh, wow. Like what?
The side effect like bone pains,
We're talking about
cranzalizumab.
Oh, okay.
Well, sickle patients already have bone pain.
Okay,
Yeah,
let's talk about it.
It's like saying when you drink water you become thirsty. But I'm already thirsty before drinking the water.
Because there is some side effect like that it cause joint pain, but it have another possible effect. What it does to blood in prolong the blood from sickling. When it bind into the blood, it doesn't allow your blood to be sickling.
But that's what we want, isn't it?
That's what you want, and that's what we thought we would be benefits as a sickle cell. However, the side effect is there, and this kind of condition of sickle is already have bone pain already.
Yes.
You understand?
Yep.
So majority of patients who are using it, when they come, some side effects affect majority. So what happens is that when the few people they choose already complaining side effects, now we have to mind some of the other people we are going to use it on, isn't it?
Yeah.
So the factors now realize that, I'll give you an example. In our trust, maybe we have only 20 or 10 patients using it. Another hospital have 10 or 20. But because 1 or 3 people have come out that I don't want this medication anymore, it's giving me more pain, it remains 7.
Yes.
Okay. Another hospital comes, you remain like 5. Another hospital. When you look at, you are a producer, and
it's not profitable, is it? Yeah.
So
money.
All right, I see.
Money.
So everything still boils down to money.
Money.
But everything about
Some
life
people-
is money.
It's all about money.
It's all about
Most
making
things-
profit. Yeah.
Most things about
So because less people is using it, they have to increase the money. Plus the side effect is too much, and some patients are withdrawing, and we have to listen to the patients a lot as well.
Yeah.
Let's talk about blood transfusion. How does it play a part in treatment? What are the risks?
And what are the benefits?
No, it has a lot of benefits. I want to hear about the risks.
Don't mind Anna. Anna is being partial.
Yeah.
Then it's anytime when he asks me about risks, obviously I'm going to talk about the benefits.
Yeah,
Because
thank you.
of course we have to talk about the benefits and the
Because
risks.
I know you, so I know the benefits.
Benefits of blood, especially when we are using blood to do automated red cell exchange. We call it apheresis. It's a major big treatment for sickle cell. I believe in it so much. It's transformation of life.
Too.
I believe in you.
The reason why I believe in it is because when I first started as band 5 and I was doing this automated red exchange for patients, and by then one of my seniors, one person that I like most, everybody knows, Sister Liz, I will call your name. And by then I was naive with sickle cell. And we bring this patient and he say, oh, they have achy chest, they have achy chest. And I will see the patient, oh, I can't breathe, and the respiratory will be going higher and the SAT will be, and by the time I did this performance of apheresis exchange transfusion, blimey, the patient who cannot talk before, we actually talk.
Superpower.
You start bouncing.
It's safe to say that sickle cell patients are vampires.
Yeah. Oh, no. Come on.
Where did that come from? I don't understand.
You take blood.
Or you mean the nurses that do a vampire?
No.
They're
I
the
mean
ones
the
taking all
sickle
the
cell
blood and putting all the blood.
blood. That's
Stop it. We're trying to break down myths and stigma.
Gosh.
We're trying to break down myths and stigma, and you brought vampires into it. Why?
Because when you take blood, your body, you're bouncing, you're everywhere.
Okay.
That's the definition of vampire.
Urgent. I didn't say that. Hannah said that. Hannah.
I mean,
I'm not your thing.
we're having a conversation here.
It's big transformation for treatment. So I love it. However, even though I love it, if that patient have it, they have a risk. And people have difference. We might be like 5 people here having blood transfusion. None of us might not have any side effects of blood transfusion, like attracting to the antibodies. So that is the major risk. Some people will say HIV, hepatitis, but I think in the past, we all see in the TV that a lot happened in the past with all that, and they have done a lot.
The blood testing and all that.
Yeah, a lot of blood testing.
People are scared of doing blood transfusion.
And some people are scared of giving blood.
That's why I'm actually emphasizing on the risk for you to talk about.
But the risk now, for me, it has been minimized. And I will tell you the reason why. Because of recent, on my own page, maybe I will give you some page of what I use in my LinkedIn. Okay. I went and visit another blood donation center they did in Bristol. Went there, and it's amazing. Yeah. And some of you can also go and visit any blood donation, and you can actually see the questionnaire they are giving to people, how they test the blood before they take it. So there is a lot of question and scrutiny before they take blood. Even if you are a donor of blood donation and you travel out, if you haven't come back within 3 months, and there is a lot of things that a lot of research has come out to minimize the risks. Another thing we are using to minimize the risks is like, don't like to be exposed the patient into the blood transfusion. The reason why we don't like to expose is like, if you can manage your sickle cell without blood transfusion, we will manage you with IV fluid, with your pain management. Yes. If it's possible, you want a modified treatment. The first treatment we would like to commence you on will be hydroxyurea. So where you can manage, except if hydroxyurea is not working effectively for you, or it give you more side effects,
then you can introduce blood transfusion.
Even before we introduce blood transfusion, we will titrate hydroxyurea to the lower level where we think we can manage you. We'll reduce the dosage. We make sure it's your level of your tolerance, right? We can manage you with that, with IV fluid, with painkiller, with you resting, what triggering your condition and everything. We use that. Just to minimize
reducing all these
things for you not to get to blood transfusion.
All your stress and things like that. Okay.
So it's not just everyone that gets blood transfusion.
No.
So for you to get the blood transfusion, you must need it.
You must have complications such as stroke, severe. That is what NICE guideline says. That if anyone have a stroke or have history of stroke and they are sickler, the only way they can manage and prevent for that stroke not to happen and to prolong your life will be exchange transfusion. You will be on it. And some patients choose, even when they have stroke and they don't want to be on it, we have to make sure they are on it, encourage them. We can't force them, but we make sure they sign something that they actually understand why they don't want to get blood transfusion with their complications. Now to step into the hydroxyurea for that person to manage that person. Otherwise, anyone that have a stroke in UK, according to our policy, even in USA, it's a exchange transfusion. So if that person now having exchange and he have side effects would be antibodies, blood reaction, and things like that. So we have to look what kind of blood reaction. Anytime we are giving and you have a blood reaction is different. It's a esophageal reaction. That's to do with what we are using to prevent clotting. We call it dextrose. We are using it in exchange. We call it ACD. It's a dextrose with glucose. So we are using it to prevent blood that we are giving that is running into the things not to clot. It can give people esophageal reaction. That is not a blood reaction. Hemolysis is the one when we give blood reaction, and within the time we give you blood reaction, 1-2 days, within 24 hours, your blood went down.
That's after blood transfusion. So your blood start breaking down.
That is dangerous. That is blood reaction.
Hemolysis.
Is that like fatal? Would the person die or what?
When your blood is being broken down,
sometimes I won't say I haven't seen patient die from it if they didn't cut it on time. For example, if a patient have been transfused and we don't know, the patient will know that he have experienced it. We will put a prevention to that patient, and we will never transfuse that patient who have experienced it before. But if the patient really need blood transfusion, there is a lot of things we can put as a prevent measurement, such as hydrocortisone, ferritin, chlorophenamine, steroid, rituximab, or sometimes they give you IVIG to prevent and suppress before they give you. But we hardly just transfuse that person unnecessarily because we know.
That
and we have to put that person that do not give blood except life-threatening condition. And your hematology doctor must know. So they prepare your treatment, pre-medication before the blood transfusion. If you are not kind of this categories patient and that you just have antibody, there's some antibodies that you might have and we don't like to expose you because the more we expose you, you are going to be attracted with more antibody. And the more antibody you have, we will not be able to get the blood that will match. That's what the risks.
Yeah, because I know people that say they can't take transfusions.
So because sometimes there are some patients that they need to come like 2 days looking for their blood. There's some patients we have to cancel their blood plan exchange transfusion because we can't get their blood.
That's why we need so many people to donate blood. Please donate blood because it's saving lives. We keep preaching about this blood donation.
It really is.
Please find the nearest blood donation center in your area and donate blood. Even if it's once every 2 months, once every 4 months, and once every 3 months. Twice a year, whatever you can do.
Please. Another thing I was going to ask is, they say sickle cell patients are hard to get like veins and things like that. So how do you do the transfusions then?
Before I go there, now have helped me to say about blood donation. I'm talking to my Afro-Caribbean.
Yes.
Please and please try to donate blood. Some people will say, I've been there, they don't accept. Please do what they recommend for you. They will recommend use iron tablets to boost yourself, do exercise, drink plenty of water for your blood to come up. Do all what they recommend and go back there to do your test. Maybe you can donate. So be a blood donor because it's very important. It's not only Afro-Caribbean we are using the blood transfusion for. There is a lot of conditions that need blood. And when we look at the majority of people who are donating, Afro-Caribbean, we are just little. We are little. So please go out there and donate. So about the question you asked that the sickle cell vein they find it difficult, I want you to remember, I'm going to be going back because that's what it's linked to. Anytime the sickling level is built up to your body, and we said the sickling always blocks the vein, it doesn't allow the blood to flow. So that's what causes the sickle cell vein being difficult.
So it becomes thin.
When it becomes so painful, now I want to cannulate a patient with sickle cell and I put a tourniquet here. One is very hard, very painful. And that person that I'm putting tourniquet here, because you have to put a pressure here before you cannulate. And I've put a pressure here, is thinking about the pain, and the person hold and is tense. When you tense, it's to reject because it's bouncing back the needle.
I actually thought it collapses.
No, when you tense, right, what happens is that if I'm going into your vein, it will tense in the needle. I will be forcing it. When I now force it to go there, your tense will not allow the blood to flow, because what happening to your tense, you're holding up to everything. Sometimes you are not breathing. Your blood is holding up. And I will put a needle, I'm expecting the blood to come, but you are tense.
Is that why they say you should relax?
Relax, breathe in, breathe out. And when your clinician said, oh, the needle is in, I can see a blood, just relax your body and let the blood flow. Because already you have sickling blood that blocked the vein.
It's so hard to relax though when there's a needle in you.
No, it's not easy though. It's not easy. But that is the techniques. If you relax, you can also tell your clinician when you are not ready, you relax me, don't do it yet. Okay, let me breathe in. They can give you some drink. They can warm your body up to make all the blood to flow very well. But if you think you are going to blood test, drink plenty of water a day, 2 days before, just warm water. It will help you a lot.
Thank you so much. The next question is actually very important. It's about mental health. What support do you give patients with sickle cell and mental health? Because I think it comes hand in hand. When you're experiencing pain all the time, you don't have a breather, experiencing these complications. Let's talk about mental health. What mental support is available for them?
There is a lot of things available with mental health. And I know that majority of sickle cell clinicians, the centers, the hospital, they do have in our team, professional team, we do have psychotherapy, psychology, because the reason why we know we always do holistic care. We provide holistic care where we know the long-term condition can affect people mentally, psychologically, especially people with pain frequently, who likes to do what other people are doing and they are not able to do it.
People like me, yeah. We like to test ourselves.
He does. He does. And I think people with sickle cell are the ones that really dare to do more.
That's why we are warriors.
Yeah.
Yes.
They are warriors.
Yeah.
They are warriors.
Yeah.
We do have psychotherapy and psychology. And if any clinician doesn't have it and we see that emotional or the moody and things like that, when we are looking after them, we observe that and we refer them with their consent that they should go and see psychotherapy or psychology.
Yeah.
We also support them when we see these symptoms with them, refer them to their GP, or even the psychotherapy or psychology we suggest, which will treat depression. And most of them always on antidepressants, which we also monitor with the psychotherapy. So it's just a long thing.
Makes sense. Because when you've been to ICU, you've come out of the hospital, you've gone in again, you're thinking about the next one.
Yeah.
It's a lot.
Especially if you have family of your own.
Yeah. It's a lot.
It can be very stressful.
Yeah.
Especially when you have yourself and you are friends with yourself as a patient, or you heard someone lost and someone just passed.
That is another big
emotional.
topic.
It's emotional breakdown.
Emotional damage.
It's a real thing because I've lost a lot of friends that have so and
it's not easy.
It's not easy at all.
It's not.
And
it's a huge thing.
Do they offer you like counseling when
Honestly,
you've lost another person?
We do.
What Sister Fumi said about psychotherapy, physiotherapy, I used to be one that didn't like talking. As an African man, African guy, we were taught to be confident, hold your emotions, you can't cry, you can't show this. It's a lie. I like that. In fact, when the psychotherapist started disturbing me to come and see her, I used to push her away. I used to like, what? I don't need to see you. What's my business with you?
Okay.
I've not come to you, so why should you come to me? All that kind of stuff. Eventually, she wore me down. She knows herself.
I know.
She knows how special she is to me. Wherever you are, if you see this video, I build you up. She eventually got to me, and that thing was the most. In fact, you can ask my wife this. It was the most helpful thing ever. In fact, that day she just sat down, and the way I spoke for an hour. I was just talking. I didn't realize I had that. Yes.
Thank you for our psychology.
I didn't realize I had all that in me. Yeah. So that just helped to relieve the burden. Yeah, it does help. It does help.
I want to dwell some point out of what he has said. I think majority of us, anytime they refer us to psychotherapy or we hear a sound of psychotherapy, say,
I'm not mad.
Yeah, I'm not crazy.
Why are you saying I'm crazy? Do I look crazy to you?
Yeah. So sometimes, even before we refer them, and I'm sure that majority of professional team who refer the patients do explain to them, you are not mad, you're not crazy. It's just for you to talk through. Sometimes there is a lot of things you cannot tell your clinician. Sometimes they have a stylish psychology to bring it out of you.
True.
And once it's out, you feel relief from your mind.
It does.
There is a lot.
That load.
And it's really good.
Yeah, it's helpful.
It's really good. I recommend it for you.
Yeah, I do too.
The next one I was going to ask is, how does sickle cell in general? We know we manage pain, we go to hospital. Some people don't like to go to hospital. The question is, are there specific procedures that are different from a man and a woman?
When we talk about daily life,
everything in general, like your daily life, the way you're performing at home.
I think it's an individual thing. How everybody is experiencing pain and how do you manage pain? Some people who doesn't take medication because they have put in their mind medication can damage their kidney and liver. And they don't use medication. Some have been trained as a foundation when their mother give birth to them and train them to drink warm water. Sleep, rest, don't expose, keep yourself warm. Some people believe in that and they do that a lot. And some people also believe that I need to use my medication, I need to seek help from hospital. Some people have their pain frequently, every back to back. Some people, they don't have it like because of oxygenated hemoglobin fetal, I told you, and they are where to do. And there are some people who are using treatment to manage. But in a daily life, what it can affect A might not affect B. What you can do might be different. What can stress you out might not stress him out. It's just differently. And when we are talking about women have monthly cycle. That when they have it monthly, Some people, they affect them badly, especially if they haven't give birth to baby. And some people, they have already give birth their mother, they still experience it. So that monthly cycle, with what I've heard, what I have seen with patients, it affects them, it triggers their pain badly. Sometimes they land some people in the hospital. And some male, they do have what we call erection.
Okay.
It affect their daily life, affect their sexual life. Sometimes it affects some female sexual life as well. Sometimes when they have pain and your other partner is feeling to have, and you are in pain, how do we?
That part's
So
the part I want to elaborate on is the erection part. I ask you, have you ever maybe in the middle of making love and you have crisis in the middle of erection?
Hey! What did you say?
I had to ask this.
This is not the forum.
This is going too far now.
No, we need to.
Wait. My job description did not tell me about this question. No. In fact, I'll say this. Yes, practicing is real, yeah. But I have to take permission from my wife.
Okay, we will visit that topic.
Yeah, I have to visit this topic another time.
We will visit.
Understand? Yeah. But it's a real thing. It's a real thing. It's a real.
But you out there, it's a real thing that's happened. Sometimes we don't have a right to be digging into private people. But I just want you to know, if you are out there, you are a warrior, you are a male or female. Yes, women might have their monthly period, they are triggered with pain, or the time you are having pain and you have a partner who has, you have to respect the pain they have. You have to comfort them. Let the pain set you before you think maybe you want to have an intimacy with them. And also, when you male warriors out there and you don't know much about priapism, what I want to tell you about priapism is real. It's an erection of penis. It can happen at any time, anywhere, any day. And when this happens, please look after yourself. The way you can look after yourself is to go and jog, or you are inside the house because it might be cold outside. Go upstairs and downstairs, or you jog, walk up and down, drinking plenty of water, use your medication, also rest.
Control your face. This is a real thing.
Oh my gosh. Right now. I wanted to excuse myself about only
the greatest most about it. Look at the time when the pain starts. If it's more than 3 hours or going to 3 hours, please go to hospital. Especially if you have your shower, you have medication, you've actually do a lot of things and it doesn't come up and it's disturbing your sleep and it's going to 3 to 4 hours. Please go to hospital. As a result of this, it causes some erectile dysfunction. So you don't want that to happen. Just seek help on time.
This is a huge topic and I believe we will go through it again another time. But
it's a topic for another day. I'm coming back to that topic.
All right, no problem.
I will.
You're going to pause me.
And we need to talk about pregnancy and family planning. We need to talk about long outlook in life, especially pregnancy and the myths surrounding it and all that. And sometimes people say the food you eat can affect or all of that. We need to talk about this.
So we want to talk about the pregnancy in sickle cell. The symptoms that trigger sickle cell, pregnancy is actually one of it. Because I'm going to put it to you, someone who doesn't have sickle cell and they have pregnancy, they always have these symptoms of sickness, morning sickness. They will throw up. Sometimes they might not feel like eating, have a low appetite.
Typical symptoms of pregnancy. Yeah.
So all those symptoms of people pregnancies who doesn't have sickle cell, they will have kind of that thing. Then on top of that, someone have a sickle cell, it will trigger their condition because one, the person will be vomiting too much. They will become dehydrated. Sometimes it will bring you tiredness, fatigue. And when someone is pregnant and the embryo is inside of you, it takes a lot of strength out of you.
Tell me about it.
So in sickle cell, if a lady is pregnant and we have known that they have pregnancy and they have been tested, immediately the clinician swing in and they will discuss the planned care for the sickle cell.
For every patient.
Every patient.
Wow, that's a lot.
In sickle cell, who are pregnancies, it is good they have what we call red cell exchange to prevent complications in pregnancies. They always becoming anemic. So someone who's anemic and they have sickling, if we don't do extreme transfusion or top up, which is basic blood transfusion, like 1 unit or 2 units. Pregnancy can make them tired and fatigued, and they will be becoming more anemic. They won't have energy. It's 2 people now. It's not 1 person. Because you have to remember, when that person has sickle disease and it's only her, she actually becoming sick before. And now he have pregnancy, he will be more sick. Because they are more sick, they need enhancements of blood transfusion, give them more energy to improve the anemia and the fatigue. We also have the obstetrician and the clinician of sickle cell seeing them every week, monitoring their blood and coming to the clinic as well. Right? So there is a lot of treatment. The major treatment will be blood transfusion for them to recommend. It's really important to manage.
It's very manageable.
Very manageable.
Do you know what? There's a myth about people. They say that lots of sickle cell patients die during pregnancy.
Another thing, even if it's manageable, I have never, since when I've been a clinician, I hardly see some of the sickle cell get to 40 weeks. They will always bring the baby out or induce them to give birth to avoid complications. Especially when they have been sickling during the pregnancy. You'll be seeing them in hospital off and on because the pain will trigger. Because you have to see, some people have symptoms of no eating, no drinking, I can't smell, I can't cook, up to the 3 months. And they will lose weight and things like that. When such situation is going on, we have been assessing, and they will say, okay, in 36 weeks, we are bringing the baby, or 38 weeks. Depend how you yourself were seeing yourself. And they will be discussing it according to your care plan. So some people is 37, some people is 38, but maximum of 38, minimum 35, 36, they bring the baby out. Or they will induce you to have a normal delivery.
So special care is needed though.
And special care is have to monitor about, sometimes it's a cesarean section, sometimes the blood pressure, the diabetics in between, pregnancy induced, they have to monitor. And some of them do have diabetes. So the multi-professional will work together, being diabetics, optician, hematology, surgical team who is going to bring the baby, and the midwife will work together as a team. Wow. And sometimes the pain management team, they work with us to manage them.
Wow.
Sometimes. So it's quite a lot. And blood transfusion back to back according to their care plan is going to be there as well.
No wonder so many ladies are so scared of getting pregnant when they have sickle cell.
We always encourage, don't be scared, because we are there to support you. Sometimes there's some people who are at risk, especially those people who have antibodies, or we don't have their blood, and it's only adversarial they can use. Sometimes it's difficult. And sometimes patients, because they face rejection, like we mentioned before, don't pregnant early, like 30s, they're always pregnant at 40, 50. We still need to manage, but when they get to the 40, 50, we advise that it's not advisable for you. But if people choose to have their life like that, we can't reject it.
Who are we to say no?
So we use human rights to let them be. The only thing is that we will monitoring that person closely, seeing that person frequently on outpatient clinics and things like that until when they deliver the baby.
So it's safe to say that pregnancy is manageable now?
It's manageable because a lot of research is out, especially the treatment I told you about, automated red exchange, is a big goal for the pregnant woman. Except if you are kind of a patient, you have antibody, they will say maybe toward you're pregnant. And that means you have to be eating food that will boost you up with hemoglobin A.
Like iron
foods and things like that. Sometimes the kind of that person, they might put them on a mild iron tablet to manage them as well. They won't be tired.
Got our superheroes here working for us, the pregnant women that got people that got sickle cell. If you're pregnant, make sure that you seek early help, and that will reduce any complication in case you're being scared of, the meat. Death meat.
But the advice is that don't be scared. Mother have you have to have your own child. We are warrior, so we can do all things as well.
Yeah.
Yes.
Thank you so much. Thank you so much for joining us. We are so grateful.
I'm so happy. Try to watch this. Give us a comment and let's know where you want us to improve.
Please.
Yes.
So in case you're not following us, please follow us on SSW Health in Color on Instagram, and our YouTube is HealthInColorPod. So please follow us, subscribe so you can know more about this.